Seen clear signs of change. The regulatory authorities aren't making it easy. It would be superb if we could see a real innovation in the use of IT across the NHS, because it would transform the way we worked. I mean, in theory, every single patient record across the NHS should be housed on the cloud, and everybody with the right access should be able to access it, and it should be inaccessible to anybody who doesn't have the right to access that information. And this sort of innovation should really only take us 5 years to achieve if we set about it in a coordinated and an appropriate way.
Here at Rinicare we have both clinical and technical expertise. We have clinicians from primary care and from secondary care. We have technical expertise in algorithm development, software development, image analysis and project management. Patient outcomes are improved in a number of ways. Quicker treatment can prevent complications associated with certain medical conditions. Patients can be transferred from outside of a hospital environment to a hospital with the appropriate expertise. So for example, patients who are having heart attacks, their ECG can be viewed before they arrive at hospital by cardiologists, who can then make a decision about where they're transferred for the most appropriate next stage of their care.
I believe what the future is not in simple monitoring and collecting the data, but the future is in what do you do with this data. To collect the data and to do the prediction using this data. This is, I think, is going to be revolutionizing everything, how the medicine is done in the future.
Digital health monitoring is using the information that's available already, but using it in a much more effective way. We hope to achieve easily applicable, easily applicable wireless monitoring for patients who haven't yet reached hospital. So for victims of crashes, where the ambulance service can arrive, apply the monitors, collect the data on an easily placeable screen that the ambulance staff can see the information, and at the same time that information is transmitted to a server where a cardiologist or another specialist can advise them firstly on how to treat the patient and also which hospital might be the best for that patient to go to, instead of just taking every patient to the local district general hospital when they might have a specialist problem that needs specialist care.
Prime can be used by anyone who is trained in a healthcare capacity, so it includes oxygen saturations, blood pressure cuff, temperature monitoring, glucose monitoring, and it can also integrate any other sensors that may be required, including a wireless stethoscope and even wireless ultrasound devices. And a full assessment of a patient can then take place outside of a hospital environment, and this data can then be uploaded to clinicians for assessment and opinion on a patient's condition. The full assessment of a patient outside of a hospital environment is a really unique. The only thing that a doctor can't do for a patient is place a hands on to examine them or perform laboratory investigations or x-rays. It also allows potentially allows quicker discharge from hospital for patients. So patients can be discharged home earlier with wireless monitoring solutions to keep an eye on them once they've left hospital, and it can even potentially avoid patients being transferred into hospital due to the fact that a full assessment can take place outside of the hospital environment. Stability is a system that utilises data collected by Prime or by other hardware solutions to optimise the assessment of that physiological data to predict early adverse outcomes.
It requires you to understand the whole principle of risk prediction, how you integrate information from various sources and create a useful, easily interpretable score when a patient is at risk.
All available data that is actually collected by the clinical team is analysed and utilised to identify signs of deterioration early. So in hospital at the moment, often signs of deterioration are missed, as they may happen in between observations or they may happen over a short period of time. Stability significantly reduces the risk of this happening by utilising much more data than has ever previously been used before outside of intensive care, safe is
One of the key challenges is the small amount of real-time data clinicians can use to make initial assessment.
currently only less than 0.001% of the data that we collect on our patients in intensive care is utilised in clinical decision making. Only small fractions of data are available to inform clinical assessment outside of places like intensive care. So in primary care or on a ward or out of hospital, clinical decisions are made on very small amounts of data.
If we can help the GPs to do their work more efficiently, spending less time simply by entering data more efficiently, then I believe it was good for everyone.
The NHS, I'm afraid, is very slow at adopting technology, very concerned about patient confidentiality, and they don't have any joined up system for adopting technology. There ought to be a national centre that is helping us introduce IT to the NHS so that the systems are compatible and so that people can introduce new technology using formats that can then be useful across the entire NHS system.
What Stability does is use the real-time data collected by Prime to make a more accurate assessment of a patient's condition and potentially identify signs of deterioration much earlier. Treatments can prevent complications associated with certain medical conditions. Patients can be transferred from outside of a hospital environment to a hospital with the appropriate expertise. So for example, patients who are having heart attacks, their ECG can be viewed before they arrive at hospital by cardiologists who can then make a decision about where they're transferred for the most appropriate next stage of their care.